Hello, I'm Carol Celine, talking with surgeon Dr. Harish Lavu. Dr. Lavu, tell us what kinds of surgeries you do.
I operate primarily on cancers of the pancreas, the bile ducts, the liver, and the gallbladder.
Wow, those are pretty serious cancers. Are there any advances in surgery in your area recently?
I think, number one, these are highly complex surgeries, and so it takes someone with a great deal of experience. In recent years, the move towards more minimally invasive surgery where we use smaller incisions such that patients feel less pain, recover more quickly, and are able to leave the hospital sooner.
So are you using instruments like the laparoscope?
Correct, yes.
And in what way?
To remove tumors in the pancreas, in the gallbladder, and even in the liver. This was something 5 or 10 years ago was never dreamt of for cancer surgery, and something that's been brought to the field in recent years.
Describe what the laparoscope or robotic surgery actually is. What do you do differently?
We use small 1 centimeter incisions rather than large midline incisions. The surgery on the inside is exactly the same, but a patient is able to recover much quicker because the incisions are so much smaller.
But are you not operating on instruments through the laparoscope as opposed to having your hands right in?
Correct. Our hands are always outside of the body, and we have long instruments that traverse the body through small ports.
It must be particularly challenging. Do we know what causes these cancers?
Pancreatic cancer is linked to smoking, obesity, and diabetes. There's also a rare form of pancreatic cancer that's related to familial risk.
Genetics. So I guess everybody listening should be thinking about not smoking and losing weight and things like that.
Correct.
Do you have advice for your patients that you give them?
I tell them that we're going to be embarking on a long journey together, and that I ask them to just take each day at a time, that there will be good days and bad days, but that ultimately we'll get through it together.
Wow, that sounds like very good advice. Thanks for coming in.
Thank you very much.